Hello everyone, my name is Paige Spitzner and I'm a senior at Millikan University. First, I would like to thank everyone for joining me today to learn more about this healthcare presentation that I have put together. For this health fair, I decided to focus on the deaf culture and the disparities they face within the healthcare setting. Deaf culture values American Sign Language, ASL, and uses this language to communicate. This culture is composed of individuals from different backgrounds. This culture is different from many cultural groups throughout the world. That is because many people are born into a cultural group. However, deaf culture is not a culture in which individuals are born into. Many deaf children are born to hearing parents, therefore, they do not gain access directly into their culture. Deaf children usually gain access to the deaf community through deaf programs in either their school or community. The deaf culture is important to focus on because approximately 20% of Americans are deaf or have some degree of hearing loss. 90% of deaf children are born to hearing parents and do not develop language skills early in life. This negatively impacts their capability to gain healthcare information and healthcare as they age. There are legislative measures to ensure reasonable access as well as protecting vulnerable populations. However, because most of the healthcare providers do not understand the deaf community, they do not accommodate cultural and linguistic requirements. Many healthcare providers do not have the skills to effectively communicate with the deaf community. Therefore, health issues may not be detected or diagnosed. Due to the language barrier, many deaf patients make more trips to the emergency room and visit their primary care provider less often. Deaf individuals are more likely than hearing individuals to experience unfavorable outcomes when looking at cardiovascular health, testicular cancer, and pregnancy and birth. Another issue that arises from the lack of communication is misunderstanding of their disease or treatment recommendations. For example, many deaf individuals lack the full understanding of common English words like nausea, allergic, and constipation. Therefore, if a provider is using these terms in an explanation of a diagnosis or treatment, the deaf individual will not understand. There are also differences between the English and ASL sentence structure, which leads to misunderstanding diagnosis or treatment recommendations. In English, you may need surgery is understood as you might need surgery. However, in ASL, you may need surgery is understood as you will need surgery in May. So understanding these differences in the language and the sentence structure could greatly impact the communication and effectiveness of the healthcare treatment to the deaf patients. To accommodate this culture within the healthcare setting, an interpreter should be provided. Due to the Americans with Disabilities Act, healthcare providers and hospitals are required to provide an interpreter or other effective form of communication like technology. However, there is a loophole within this act. This act states that this must be done unless an unnecessary burden will be placed upon the healthcare worker. Elimination of this loophole statement would increase the quality of care deaf individuals receive. There should also be interpreter registries and developing communication technologies for interpretation readily available in every healthcare office or hospital. Again, with having these accommodations readily available, communication between healthcare providers and individuals within the deaf community, as well as the care they receive, would increase. Providers should also be given the opportunity to learn basic sign language and communication strategies. The basic sign language could include medical terms as well as common communication words or phrases. The providers could also learn about basic ASL sentence structure. This would help the patients understand the provider's treatment recommendations as well as the diagnosis. The deaf community is fairly prevalent within America, with 20% of Americans being deaf or having some degree of hearing loss. 90% of these individuals do not develop the basic language skills that are needed to effectively communicate with the hearing population. Healthcare providers and hospitals should provide interpreters or communication technology to deaf individuals to decrease the language barrier. Decreasing the language barrier would increase the understanding of diagnosis and treatment recommendations. It would also increase the amount of visits that the deaf individual would make to their primary care physician if they feel like they could be understood or like they have some common ground of understanding with their healthcare provider. These accommodations should not be looked at as an added burden, but a way to give the patient the best care possible. Thank you all for joining me today.